Hello, beautiful people. My name is Suliat, and today I'll be discussing an important topic, which is consent. When we say consent, what do we mean by consent? Is when you give permission for something to happen or you sign an agreement. Well, maybe not sign because consent can be in the form of verbal, where you tell someone, you give the person permission to carry out something or do something on your behalf, and then we have the written consent. Yeah, so this topic is mainly targeted at healthcare workers. However, everyone would benefit from it because we need to learn the act of seeking consent both in our office spaces, in the markets, in our churches, in our communities, in our societies, anywhere we find ourselves. We should learn and we should learn the habit and act on seeking consent. Don't make assumptions on people's behalf. Don't decide because there are consequences for not seeking consent for people. So before I dive in straight to our topic today, I would like to give a shout out to all healthcare workers, especially our nurses who are looking after our loved ones, who are taking care of us. You guys are the real MVP. So moving straight to our topic now, as I said, consent can be in the form of verbal or written consent, and there are consequences for not taking consent. Let's take a look at this video where this woman explained the consequence of a healthcare worker not seeking consent. Let's look at it.
Now, the reason why I decided to make this video today is to share awareness on medical consent. It is your right. It is your right as a patient to know whatever a doctor is administering to you. It is your right. It's not a privilege. It is a right. Now, while I was in labor with Ismail, my doctor came into my room and asked me if I was feeling any form of pain. And I confirmed and affirmed that yes, I was in a lot of pain. Obviously, I am in labor. Labor is supposed to be painful. And this doctor reached out into his pocket, brought out an already prepared medication in a syringe. And he opened up my cannula and he injected. Now, immediately after injecting, I fell asleep. And that was it. Now, even while asleep, I was still I could feel the contractions coming. I could feel every single pain, even while I was sedated. I remember while sedated, I was shouting out my sister's name because I was feeling the urge to push out the baby. And she couldn't hear me, obviously, because I was sleeping. But in my mind, I was trying, sorry, boo-boo. In my mind, I was trying as much as I could to talk to her. Now, what saved me was she noticed I was moving a lot. There was a lot because I was in a lot of distress. She went out and she called out the nurse, and the nurse came in, and already the baby's head was crowning. And she ran out, that's the nurse, and she called the doctor, and he said, no, he's timing. It's not time yet. And she said she has already seen that the baby is crowning. Meanwhile, my water has not even broken. And the doctor rushed in. She rushed back first before the doctor came in, and they held me. She held one hand, my elder sister held the other hand, and I walked. In that situation, at that position I walked to the labor room with the aid of my elder sister and the nurse. And the doctor came in immediately after they placed me on the bed. Now, at this time, I was already coming out of the sedation. They came in, the doctor came in, and before he could wear his gloves, because at that time my eyes were already open, and the baby just came out like he was pushed out by force, because I had a very big push and he came out. Now, when he came out, he wasn't breathing. There wasn't any form of life. He was not crying. He had what medically they call severe birth asphyxia, which is a situation where you give birth to a child and the child comes out not crying, not breathing. There's no form of life. And they had to resuscitate him. Now, during the process of resuscitation, they didn't have a pediatrician on ground, and this doctor had to do everything over a phone call, because he called the pediatrician they were working with hand in hand over the phone, and that was how she was able to guide him over the phone. Now, this is my son. He's 7 years old. He has severe brain damage. All his life, he has lived in constant pain because he has spastic cerebral palsy, which is a cerebral palsy that makes you extremely stiff. He has had 2 surgeries so far. Sorry, boo-boo. He has had 2 surgeries so far. One was for undescended testes, and the other one was a stem cell that we had to do to improve the quality of life. Sorry, boo-boo. Now, cerebral palsy does not have a cure because it is a brain damage that is irreversible. He's in discomfort. But I want you people to see, this is what lack of consent from a medical doctor cost my family. This is it. What will it take a doctor to explain to you that after giving you this injection, you will fall asleep, and after you fall asleep, definitely there's not going to be supply of oxygen to the brain of the fetus you're carrying. And this is the result. This is the consequence of an action of one human being who decided to take matters into his own hands without looking for consent, without seeking for consent from me, the person that was in labor, without even actually informing me what it means for me to be sedated while in labor. This is 7 years of pain and torture and agony. This is 7 years. This child does not know what I look like. He can only hear me, but he doesn't know what I look like. He doesn't know what any of the family members look like because of one doctor's decision to sedate a pregnant woman in labor to sleep and without monitoring.
So yeah, I hope we have all seen that video, and we've seen the consequences that not seeking consent can cause on us as human beings, as an individuals also. So yeah, moving back to the 18th 19th centuries, we've seen a lot of researches and experimentations, such as the syphilis, the tuberculosis, the cholera, to mention but a few. Those experimentations were done on prisoners, children, pregnant women, without seeking their consent, and we've seen that they are unethical. And we are in the 21st century. We've gotten advancements in technology, advancements in medicine, so I don't think such should continue happening. People are more aware now, they are more informed, they know their rights. So carrying out a procedure or anything on people's behalf, on their behalf, without seeking consent can lead to legal consequences, which we don't like. So, and the benefits of consent is it cannot be overlooked. People will feel informed. They are involved in their care. They feel as an individual, my voice matter. I have a right to myself. So yeah, that is why it is very important. No matter how little or trivial we think the procedure or what have you is, we need to seek consent from people who carry out that procedure or whatever you find yourself is. Please seek consent before you do it. Yeah. So I'm going to stop here for now. Thank you very much for listening. See you guys later. Bye.